In this module, we're going to talk about the best person to talk to about your Medicare questions. And really, the best person to talk to, it depends on what your situation is. Depending on the situation, there's going to be a best person to talk to. So let's say you got questions about eligibility or past plans. Probably the best person for you to talk to is Social Security Administration. You can basically go to Medicare.gov or call them at 800-633-4227. Call them and they're going to be able to tell you if you're worried about when you'll first qualify for Medicare, you can call them and ask them. Also, like current or past plans, there've been clients that have come to me and said, "Hey, I got placed in a new plan, but I want to go back to my old plan and I don't know what it is." Basically, all we do is hop on the phone, we call Social Security, and they tell us exactly what plan that they had. So if you want to go back to an old plan, you're not sure which one it was, just call Social Security and they're going to have all that stuff in the system. Another reason that you might want to call Social Security is if you want to apply for something called Medicare Extra Help program. And this is a program that pays for your Part D prescriptions if you have a low fixed income. For questions related to eligibility, past or current Medicare plans that you have, or even signing up for that extra help program or seeing if you qualify, call Social Security. And I'll put their telephone number, their contact information in the description below. Now, Medicare Advantage, they are the best people to contact if you have questions about your network. Specifically, if you want to know if you can go to a certain doctor or a certain clinic or hospital. If you have a Medicare Advantage plan, you want to contact them. Now, let's say you have original Medicare and a supplement. You don't have a network. If you have that combination, you don't have a network, you can go pretty much anywhere. You still want to call the clinic, call a doctor, call a hospital, make sure. But for the most part, if you have original Medicare and a supplement, you're going to be able to go anywhere in the country. Now, again, Medicare Advantage plan, these plans typically have networks that you have to stay in. So if you do have a question about what doctor that you can see, you'll want to contact the Medicare Advantage plan. Also, if you have a question about whether you can get a certain procedure, whether your insurance will cover it, contact the Medicare Advantage plan also, because with Medicare Advantage, they have something called prior authorization, and you have to go through your doctor in order to get approval for seeing specialists and getting specific procedures. So again, questions about your network, if you have a Medicare Advantage plan, go through them. Now, an independent Medicare agent like myself, this would probably be your best option if you need to choose a Medicare plan that fits your specific needs. Independent agents, we represent a number of different Medicare plans. So what we do is we look at your doctors, your prescriptions, and we pair you with a plan that best matches that. Now, if you go with a captive agent, and they're not always bad, but with captive agents, they work for that company. So let's say captive agent who works for company A, because I don't want to throw any names out, who works for company A, they're really only going to show you the plans that are with that company. They're not going to show you plans with company B. Whereas me, let's say your first preference is company A, but we see that your doctor is not in network. Well, I'm going to show you company B, C, and D and see if you like those. So again, if you want to get a Medicare plan that fits your needs, specifically you might want to talk to a independent Medicare agent. Now, if you don't want to talk to an independent Medicare agent, then what you can do is contact a state health insurance plan or a SHIP, and they provide non-biased advice on Medicare. So if I tell you something, if I give you answer your questions about Medicare and you just don't believe it, you need more, you need somebody else to kind of verify that, you can go to a state health insurance plan. And again, this is non-biased advice on all things Medicare. Also, with a state health insurance plan, they can tell you how you can apply for a Medicare savings program. And again, a Medicare savings program, this is a program that pays for your Part B costs. This might be deductibles, co-insurance, co-payments, things like that. So when it comes to best person to contact regarding a Medicare question, it just depends on what your question is.